Hey guys, Dr. Shook here. Hope you're doing well today. Hopefully, I'm not upside down. Please let me know if I am, or if I'm sideways. Yeah, yesterday it was funny. It was funny that the live stream was. Let me get rid of some of these notifications. That the live stream I had my phone rotation lock on, and it had me locked sideways. So hopefully, I'm not turned sideways right now. And hopefully you guys can hear me okay. Let me know if you have any problems hearing me. But what I wanted to talk about today was today I reviewed, tell you a story today. I reviewed, had two different clients of mine. And hey, Christy. Hey, Christy. Hope you are doing well. Hey, Vaughn. I'll try to answer some of the questions in a second. Let me just tell you this real quick. So today I had two of my clients that we did testing reviews. So, usually when I work with someone, we'll do a really detailed history. We'll gather a ton of information on them, and then I'll make recommendations on ways that they can approach their problems. So, everything from like, let me give you dietary recommendations at a minimum to doing really extensive testing the immune system and just, going really, really, really in depth. So today I had two different test reviews, and I want to tell you about one test review. So as a 53-year-old mother, she has two kids, married. She has a full-time job. Her main problems are completely worn out, right? Just absolutely zero energy. She has weight issues. She's trying to lose weight. And she also has problems with her libido. She has like no interest in sex. She's very, just does not have any interest. And she's just worn out. She comes home. When she comes home in the evenings, she just doesn't want to do anything. She doesn't want to. She doesn't feel like she wants to, but she doesn't have energy to, right? And so these were some of the things that she's telling me. And really what we saw that was happening is that this is really affecting her relationships. I mean, that's what this is really, really doing. So this is the thing, her husband doesn't understand like why she's not, able to, why she doesn't have any energy. Right. And I'll tell you, because she's been to her doctor, and, if you don't feel well and you feel like this and you can't lose weight and you just feel, you have no libido and you want to be there for your significant other. She went to the doctor, and the doctor told her that everything looked fine. Nothing was wrong. And I hear this so much. I hear this so often. I really do not like when healthcare providers tell people that they're getting old or that you have kids, or some kind of lame excuse. That is complete BS. You can't make statements like that without doing really thorough investigations of someone's physiology. And checking a TSH level does not cut it. I'm sorry, that's not even close to what people need to understand what is happening to their bodies. So she was told all this, and of course, her husband wants updates like, hey, what happened at the doctor, right? Well, what happened at the doctor was they told her that she was depressed and that she was just getting older, and that she was probably getting, she was menopausal. She was postmenopausal, so she went through menopause, and she was still having like some hormonal issues, though I guess it wasn't quite, she's not quite normalized. And really a lot of it comes back to like blood sugar issues and some other things that we discovered. You can't have normal hormones with some of the physiological things that we found out. So she's not able to like help her kids with homework. She feels like she's just completely like exhausted when she's trying to think. So it's really affecting her relationships. And this is what I really want to talk about, was how thyroid problems can destroy relationships, because it absolutely can, because you can't see it. You can't see the problem. So, she went through all these things, and this is affecting her work, and her self-esteem is not good, and she doesn't feel like she has energy to exercise. I mean, you guys probably, I'm sure that plenty of you watching this can at least relate to some of this, because this is so common. We see this so commonly, and it's completely unacceptable for the providers to not, what you do, you don't weigh in on the questions. You just say, I don't, you just say, patient, I'm sorry, I don't know exactly what's going on. I'll do the best I can to help you. I don't see anything here on these labs, and be honest. Don't just try to make up something because you don't want to say, I don't know, or you can't figure it out. But don't make the person feel like that there's something, that they're broken psychologically, like there's something wrong with them. This is what you do. You put it off on them. You make it their fault. And so complete garbage, not good. So what we did was today was a test review day. So I'd already talked to her about this stuff. I knew what was going on. I made some recommendations to her and we had all of her test results in. So we were reviewing what we found. So, okay, get this. She goes to her doctor, no problems, right? Everything looks fine. Everything looks fine. You're just tired, getting older, and that's what's happening. So this is what we found. And I actually am looking at some of my notes here from her because this is how much stuff we found. So she ended up, so the first thing that we did was we looked at her blood work, because one of the main things that I recommend people do is that they get blood work done at a lab near them. So we help them get the blood work done no matter where they are. I work with people across the US and in other countries. It's easier in the continental United States, but we can do it in other countries. So I'll send them to get blood work done. And I'm talking about very extensive blood work. And they get a very expanded panel. And the first thing that I do, and we had on this particular client, we had a ton of different blood work. We had biomarkers that were blood that would be considered more standard, but very, very expanded. We had a stool panel, a DNA-based stool panel. We had a cortisol panel. We had sex hormones. We had estrogen metabolites. We had food sensitivities, pathogen screen, those are all immune based. So it's a blood based test that looks at antibodies in the blood. And this is really good quantitative data that is repeatable testing. Like I will not use. There are all kinds of companies that approach me and want me to want me to like try their tests out. There are very few companies that I use that have the highest standards for testing methodologies, whatnot. So we did a pathogen screening looking at over 30 different human pathogens, all implicated in human autoimmunity, known in the scientific literature to contribute to human autoimmunity, either trigger it or perpetuate it and continue driving it. We also looked at chemicals. Now we looked at chemicals from a perspective of the immune system as well. So we're looking at antibodies that are reactive to chemicals in the blood. And so it's called a chemical immune reactivity screen. It's a new test. It's cutting edge functional immunology. It's really cool stuff. And it helps us to understand those three tests in particular, the foods, the pathogens, and the chemicals, help us to see what is the immune system reacting to. Because we knew that we knew that she had Hashimoto's. She had antibodies that were positive to, so Hashimoto's is an autoimmune thyroid condition. It is what causes the low thyroid in over 90% of cases, guys, 90% of cases. In the United States anyway, in industrialized countries it is. So she ended up having, she has Hashimoto's. So we wanted to assess the immune system so we could try to figure out what's driving the immune response. Like, what is your immune system reacting to? Is there something that's chronically activating it that we need to try to get out of the body, right? So foods, different types of infections, chronic infections, mind you, and then chemicals that you can be reacting to. So she had tons of foods. Well, I'll go back through and explain what we found. I'll start with the blood test first. We had all those things. What else did we have? I think that was pretty much, that was most of what we had. So those were found. That's a fantastic workup. It's a fantastic workup. So what we did was looking at her blood work. The first thing I did, I had all this testing. The first thing I do is I open up the blood work and I look for inflammatory markers because I want to know if there's a high level of inflammation. This is quantitative, like we'll look at like C-reactive protein, homocysteine. We will look at antibodies and stuff like that too to see if there's an immune response that's ongoing. But she had lab high C-reactive protein. Okay, C-reactive protein is an active inflammatory. It's a marker of active tissue inflammation in the body. It was lab high. But yet these are things that are not considered by it's not acceptable for a provider to order these tests for you in a conventional model without sufficient symptoms. So it's crazy. You have to be sick before they'll test you for a problem. It's like, I don't feel good. How about testing me? Well, the problem is it's not that the doctors and the providers don't care. It's that the insurance companies dictate what can and cannot be ordered based on a standard of care. And that is all developed by doctors, administrators, and people that are looking at what is considered like best practice guidelines. It's designed. The idea is that it's designed to help lower cost and prevent ordering of unnecessary testing. Okay. whatever. I mean, I guess, yeah, I guess there's always a time and place for that. You have to think about those things. But I just know that we need to do testing to figure out what's going on with people. And you have to cast a wide enough net because so many different biochemical problems mimic one another. They look like the same thing. The person has this, you have 20 people that have fatigue and they all have different biochemical drivers of that process. You can't just say, oh, you're tired. Let me check one biomarker. It doesn't work that way. I wish it did. So lab high inflammatory markers. She had her vitamin D was lab low. Now, that's important with autoimmunity. That's really important with autoimmunity because it helps with the regulatory function of the immune system. If your immune system's attacking your body, do you think that there's probably an issue with the regulation of it? There's a very likely chance that that's not an ideal physiological state. Something is not right. The immune system's attacking you, which it should be protecting. So vitamin D helps with your body produce regulatory cells that help to balance, literally regulate the immune system. So vitamin D was lab low. We saw that her liver enzymes were elevated. Her ferritin, her iron, so we look at five different iron markers for iron, and her ferritin was a 10. It's far too low. Ferritin needs to be at a target of about 70, and then we have to have saturation at about 33 is typically where we want to be. I digress with some of the technical stuff, but ferritin is really important for a ton of it's iron. It's a stored form of iron. It's the body's best indicator for iron status. So her ferritin was at a 10, and you have to have iron as cofactors for biochemical processes to occur in the body. It's important for thyroid hormone conversion. It's important for so many things. It's important for normal red blood cell health. Okay, so whenever I see someone that has symptoms like this particular client with the fatigue, one of the first things I want to know is there inflammation? Because that will blunt and disrupt so many biochemical processes. It's unbelievable. It's like our top priority. What's driving that? And then when you see the fatigue, you also have to ask yourself, is there a blood sugar problem? Her blood sugar looked pretty good here. And you have to ask yourself, is there a problem with oxygen transportation through the blood, which is the job of the red blood cell? Okay. Well, your red blood cell can be affected very negatively if you have a low or insufficient iron. It's typically a smaller cell. It's called microcytic. It tends to have less of a red color because the hemoglobin's not normal. So it can't transport oxygen efficiently. And if you can't get oxygen throughout your body to the cells where it needs to go, you can't produce energy and you will be worn out. Just ask anybody that's, I've worked with a lot of women that have menstrual cycle irregularities. And if they bleed heavily, if they have fibroids, PCOS, endometriosis, any of these things that cause heavy bleeding, they will tell you that they have no energy. And a lot of women will tell me when I talk to them, yeah, my doctor told I'm always anemic. They'll just tell me I'm always anemic. I'm always anemic. And I'm like, that can't be. That's not good. That's not a good physiological state to persist. Something has to be figured out. You have to do something to right that problem. Anyway, so her red blood cells were getting smaller. So I knew there was an inefficiency of oxygen delivery. So this is just from the blood test. This is not even any of the immunological stuff yet, but everything's okay, right? Everything's fine. Nothing's wrong. Everything looks good. That's because the healthcare system in most industrialized countries is focused on identifying disease. And if you don't have that disease that they can put a label on, you're not sick and there's no treatment for you. And even if you are sick, it's typically with a chronic disease, it's something they can identify. It's typically a medication that's working on symptoms and not the driving processes. Okay. So she's got all these things going on with her blood work. Okay. So then we shift. So that's just one panel. That's just the standard labs. That's like the first and my top recommendation for people is get that panel done. If you can't do any other panels, you get that, my foundational recommendation protocol done. So, okay. So then we look at her cortisol. Cortisol is a stress hormone produced by your adrenal glands. We looked at her cortisol rhythm of production over a 24-hour period because your body produces cortisol in a rhythm where it's higher in the morning, should be at its highest, and then it drops throughout the afternoon, and then it will gradually start to rise through the night, and then it peaks again in the morning. Okay, that's the normal physiological rhythm, a circadian or daily rhythm of cortisol production. Okay, a lot of people have that rhythm flipped. and it's one of the reasons they can't sleep. A lot of people have a completely flat rhythm. There's no rhythm to it. They don't produce enough cortisol. Sometimes it's really high if they're in like an alarm state, right? If they're in more of a state of like an alarm or emergency kind of response, the body will pump out more cortisol, but it can't sustain that rate, and you'll see different states of adaptation of the adrenals. Okay, so hers was pretty flat. She didn't have the peak in the morning. It's why one of the reasons she was constantly fatigued. It's also one of the reasons hormones were off. Oh man, I could teach. There's so much physiology here that I could teach, but just understand this. When your adrenal glands, so first of all, there's something really important here, because a lot of people have stumbled upon things and they'll say, well, I think I have adrenal fatigue. Okay, if you have adrenal fatigue, or if you think you have such a thing as adrenal fatigue, it's really just a state of adaptation of the adrenals. I wouldn't really call it adrenal fatigue, but if you have no cortisol, well, I mean, first of all, you want to be checked for things like Addison's disease, which is autoimmunity against the adrenals. But if it's not that low, if it's just flat and it's functionally low, it's not like pathologically low, then that will significantly disrupt your energy production. And it's my point here is it's always in response to something else. The adrenals are never the primary problem. So even with like Addison's disease, where the immune system attacks the adrenals, that's not the adrenals, it's the immune system that's causing the adrenal destruction, right? So the adrenals are always in response to something else. So when you see an altered production of cortisol or flat cortisol, you always have to look for the stressor. Like, what's stressing the adrenals? Why are the adrenals this way? Was there an prolonged emotional stress? Is there an inflammatory process that's ongoing? Because inflammation would do that. Is there physical pain? Because pain also will cause your body to produce cortisol, and you can't maintain high cortisol output forever. You will run out of the substrate, what your body requires to produce cortisol, and it'll be flatter. You can't do it. So anyway, low cortisol. Her sex hormones were low, primarily. My opinion on it at this point is due to the prolonged output of cortisol. You steal away some of the required hormones to make your sex hormones. They're all part of the same physiology. They're called steroid hormones. So her sex hormones were off, her adrenals were off. She has this inflammatory process. All these things are going on, right? Actually, the interesting thing is that her thyroid hormone levels looked pretty good. Was a great case I wanted to share with you guys, because that is exactly what you see happen a lot of times. I'll see people that have a thyroid problem, but their labs actually look pretty good. It's all these other layers of issues that are ongoing. Usually it's an autoimmune process. It's an autoimmune process, and that I think is one of the biggest things that's affecting her here, and that's going to be one of our biggest our strategies. So cortisol rate and rhythm was off. Her estrogen metabolism looked good, which is a good thing. She has a family history of breast cancer, and anytime you have a family history of cancers, especially breast cancers, I always want to understand and try to see what is the person's metabolism of estrogens. How are they clearing it? Because when you break down hormones, all hormones, they go through the liver primarily, and they're made water soluble. So they have to be eliminated through the urine, sweat, and feces. Okay, so you can check the urine to look at how the body's breaking down estrogens, for example. And there's some metabolites, which is just a breakdown byproduct, that are very toxic to the body. They can encourage tissue proliferation and growth. They can break DNA, double strands of DNA, and cause mutations and lead to cancer. We know that. So we want to look and understand what's happening there, right? See what's going on with the estrogen metabolism. Looked good. And then, okay, so then we get into the immune-based testing, okay? So the immune-based testing that we looked at, we did something called we did a few different tests to look for things driving the immune response: foods, pathogens, chemicals, okay? And then we also did something called a tissue antibody panel. So we looked at over 30 human tissues to see if she had expanded autoimmunity, because I was really concerned about this because of some of her symptoms. Her gut was, she felt she was over, she is technically considered obese, though she's technically, if you go by body mass index, the height and weight calculation, she's technically obese. but she feels really bloated, and that comes and goes, especially with food. She thinks she has a problem with gluten. When she eliminated it, she felt better, but she bloats a lot. So there's something really interesting with Hashimoto's called Hashimoto's triad, and it is a very common uh, uh, three different autoimmune conditions that are commonly found together. Hashimoto's, if someone's going to have expansion, so it's interesting with autoimmunity, it doesn't just sit still. What it does is the autoimmune process, it will expand to other tissues. It's called epitope spreading, where your immune system recognizes whatever it sees as foreign. It makes an antibody that will attach itself to a shape, to a protein structure. And the protein, if the protein structure has a similar shape to another protein, like let's say your thyroid TPO, which is thyroid peroxidase, it's an enzyme in the thyroid that's the target of Hashimoto's, primary target of Hashimoto's, the autoimmune process against the thyroid. It has a similar protein structure to the gastric lining and to transglutaminase, which is found in the intestines. And so you often find that people that have Hashimoto's will also have, if you're going to see expanded autoimmunity, you're going to see reactivity against the gut lining. You'll see celiac disease at a higher rate, and you'll tend to see pernicious anemia, which is an autoimmunity against the gastric lining. Okay, so it can affect your ability to absorb B12, pernicious anemia. It can create problems with stomach acidity. You can have a lot of digestive tract problems. So she had reactivity against the parietal cells, the lining of her stomach. She had reactivity against transglutaminase, and so she basically had the triad. And I'm like, okay, so nothing's wrong, right? The doctor like, there's obviously nothing wrong. I mean, I'm like, what? We gotta do better than this. We gotta do better than this. I mean, even a good history would have picked that up, like like bloating of the significant bloating. But you go to your doctor and what do you have, like 5-10 minutes maybe max, and you say, hey, I just feel like I'm gaining weight. I'm always feel like bloated. I mean, if they don't dig and they don't have time to really focus on that, they'll never get to the fact that, oh, it's with foods and my stool has some mucus in it. And so, I mean, it's just, it's just not good. So anyway, the autoimmunity, there was expanded autoimmunity. So she had multiple food sensitivities. So we did 180 foods, cooked and raw versions of food. Very important to note that you have to check cooked versions of food, guys. Cooked versions of food. You have to also check cooked versions of food if you're going to do a food sensitivity panel. And that's not the first test you should do, by the way. A lot of people reach out to me and they're like, hey, I need to get my food sensitivities checked. Probably not the first thing. It's like probably not the first thing. I'll tell you that. There's a priority, there's a hierarchy of assessing and working up these problems, and that's not a top priority. Trust me. There's a reason there are food sensitivities. If you have, so we did a DNA based stool panel. So she had candida, yeast overgrowth, and there were multiple bacteria that were possibly pathogenic at high levels. So we knew there was gut dysbiosis. There were a lot of issues. Okay, so we knew that we had GI tract problems. We had high surface immune reactions in the gut. Secretory IgA was up. There were several things that were going on there. So just absolutely mind blowing when you start looking at this, right? So she had tons of food she's reacting to. And anytime I see someone that has a lot of foods they react to, I'm thinking infection. Where's the infection? In the gut primarily, because when you have an infection in the GI tract, like a chronic overgrowth of something, it's probably the candida in her case, which candida is actually connected to celiac disease, guys. It's connected to in a documented trigger in the scientific literature to celiac disease. Okay, so the candida can break down the intestinal lining, making it more permeable or leaky. That will allow food proteins that food that you're consuming as it breaks down and the proteins in the food. Think of the protein as like a chain with let's say it's a chain with 10 links in the chain. We're going to use that as an analogous to a protein in food. Okay, when your body makes enzymes, your stomach, your saliva, your pancreas, your bile from your gallbladder, your brush border of your intestinal lining. These all have enzymes everywhere, and enzymes cut the chain. Okay, they cut the chain and try to break it down into individual links, which are called amino acids. Okay, when you join amino acids together, you make a protein. Okay, enzymes cut the chain, and that's what your body needs. It needs all those proteins cut. It needs the individual amino acids broken free, but usually as it starts breaking them down, it will cut it. Let's say it cuts the chain in half, and then it cuts it again. So you might have like 3 links together. That's called a peptide. Okay. Now, as that's going through the GI tract, it can leak if there is an inflamed or damaged gut lining. That can leak through the porous or permeable lining into the bloodstream. When the immune system sees this large peptide or protein, it doesn't know what it is because it's expecting to see amino acids, smaller pieces, right, that it can use to rebuild and help with physiological function. So this peptide will stimulate an immunological reaction, and it drives an immune response. Infections will often lead to, in the gut, to reactivity to all kinds of foods. So what do? That's why you don't do food panels. You don't do like a food sensitivity panel first if you're trying to prioritize what you're going to do, because you'll just find that you react to all kinds of foods. And guess what? You stop eating those foods and you eat foods you're not reacting to, and what starts happening? You start reacting to those foods because you still have a permeable intestinal lining due to something going on in the gut. Right? Or it could be autoimmunity. I mean, you can't have. I work with so many people like this lady. She basically has an inflammatory bowel disease. She has celiac disease. That's an inflammatory bowel. The immune system attacks the gut lining. So you have like the worst type of inflammatory or the worst type of leaky gut. You have one that's driven by, now it's driven by the immune system reacting to the gut lining. So we got, and there's nothing wrong, right? She goes to her doctor and you're just getting old. Really? That's it, huh? That's it. I just don't like. I'm not trying to be hard on the doctors at all. I mean, I've got a lot of good friends that are doctors, and everybody's trying to care for you guys. But we have to be careful with how what we say to people, so that we I don't know. So we allow them to, we believe them. You know, we believe in people, and you don't like lose belief in them when they tell you something. I always believe them. I don't care. I mean, I just believe you. If you say you don't feel good, I believe you. And if I don't see it on a test, it's not your fault. It's just we don't know what's going on yet. You know what I mean? It's just like ridiculous that we tell people, we make these stupid excuses that are actually damaging to them. You know, so I'm not good with that. I'm not good with that at all. So because all this stuff's going on, right? When I do testing like this, I'm like, this is ridiculous that this kind of stuff is driving these problems, and that there's not acknowledgement of this. And the reason, like, we know that, so I'll get to that in a second. Let me finish though. So with the pathogen screening that we did, okay, so we did a pathogen screening. So I'm talking to you now about the immune system based testing that we did. So we did something called a pathogen screening. Now the pathogen screening looked at over 30 different types of infections, pathogens, bacteria, viruses, fungi, and parasites. And it looks for antibodies against them. So they draw your blood, and your immune system, if it sees a particular pathogen, it looks at typically the protein structure in the pathogen, somewhere in the pathogen or part of the pathogen, and it makes antibodies that will stick to it so that other immune cells can come and attack it and destroy it. You can have an immune response against it, right? It's the way that the immune system recognizes it as foreign. So if you do a pathogen screen, you look to see if the immune system has made antibodies against all these different types of infections that can be present. And this is really important because all of these that we screened for have been shown in the scientific literature to either trigger or perpetuate autoimmune conditions. And we knew we were dealing with autoimmunity before we even ordered any of this testing. So when we were looking at the infections, it was interesting because she didn't have really any of the common things that you might see. So with Hashimoto's, it's really common that people will have Epstein-Barr or mononucleose Epstein-Barr reactivations, like they have reactivations of the virus, or they'll have multiple viruses that are reactivating. But she didn't have any of that. And she didn't have, I mean, it screened for a ton of different things. But what she did have that was pretty interesting to me was she had the bacteria that causes gingivitis. So she had oral bacterial infections. And now here's the thing. These are chronic. They're not acute. There's a difference. So when you have like acute infections, there's typically real obvious swelling. And if you look at the white blood cells, they tend to be really high. This is not that. This was not that. That's usually what people that have autoimmunity, they don't tend to have like acute infections. Like you go to your doctor and you have a fever and stuff. That's not what they have. They actually have lingering bacteria that are that the immune system sees and is observing but cannot get rid of it. And you'll tend to see that the white blood cells are actually normal or low in these people. And so these infections are just kind of exhausting. One of the theories is that they're just kind of exhausting the immune system. They're persistent. The immune system cannot kill them or get rid of them. And it is exhausting it because it's constantly trying to mobilize the immune system to kill off these things, right? So anyway, she had these oral infections. So we're going to do an oral protocol to try and get rid of that stuff. Now, there might be an issue with a root canal that she had, and she may have like a pocket. So I am having her go to a biological dentist if she can and get her mouth imaged and an opinion there. If she can do that, if she can do that. If not, we're going to run our protocol, and there's a lot of stuff that we can work on for sure. I don't think that is like the limiting thing, though oral infections are a big deal. We know, for example, that with cognitive decline and Alzheimer's, those same bacteria, the P. gingivalis, the bacteria that causes gum inflammation, that has been found in the brains of people with Alzheimer's. Like they've done studies on brains of people with Alzheimer's, and they're finding pathogens in the brain. They're finding herpes viruses. So if you get cold sores, that means that's a herpes virus. They have it doesn't mean if you have that you're going to have Alzheimer's. It does mean you need to keep your immune system healthy and do things to keep viruses at bay. Okay, keep them from reactivating a lot. Keep your blood-brain barrier healthy. So anyway, we found that. So we're going to do like an oral. Part of what we'll do will be an oral protocol with her to try to rid her mouth of these pathogens. So we found that, and she also had reactivity to several chemicals. So the chemical immune reactivity looks at a ton of different chemicals. It looks at tetrachloroethylene. It looks at tetrachloroethylene. There's several. So let me just flame retardants that they put on like fabrics. That's what they do. Like, you see if you look at like a piece of furniture or something, you see the tag on it, or worse, you look at bedding or like kids' clothing, and it has this tag and it says it's compliant with like the California, legislation. Well, that tends to mean that it's like not that it's flame. It has a flame retardant on it as one thing. So and it's the crazy thing, guys. It's like, we load the foam rubber, which is not good anyway, but like the foam and couches and stuff, like that's a chemical mixture that they just mix, and they put these flame retardants in them, and they also put on the surface of the fabrics, they put flame retardants all over it, so that if someone's sitting there and smoking their cigarette on their couch and they drop an ash on it, it just doesn't go up in flames, and it's less flame retardant. But when you sit on it, or your kids, heaven forbid, or like babies crawling around the floor, the couch has been, let's say the couch is a few years old, and the foam rubber starts breaking down, it disintegrates, and it's like dust. And guess where that goes? Right into the floor, right where the little babies are crawling, right where you're walking barefoot. This stuff is, I'm going to tell you right now that chemicals, I think, pose one of the, in my opinion, that I think they pose one of the greatest risks to our health. I think they do, because they're everywhere in our environment. I mean, you get in your car when it's warm and it smells different. Well, you're getting off-gassing from the foam and the plastics and everything else. And so anyway, this lady had reactivity to several chemicals. She had reactivity to mercury. She had and this was immunological, so we're looking at antibodies to mercury. So I'm like, okay, where's the mercury at? Is it in like, where are you getting exposed to that? Is it in your diet? So we have all this data. Okay, so I'm done with the testing stuff. So we have all this data. Now what we do, and I talked to her about this, is we have to approach this in phases. So we have to work on the top priority things first. Like, so we know, we know that she has, like, for example, these chemical immune reactions that to chemicals in the environment stuff. Well, you don't start by like doing a, a detox, so to speak. You don't do that first. There's so many problems with that. You have to get her foundational physiology right first, and typically just start, working on improving nutrient potholes or deficiencies, making sure the vitamin D levels are coming up, getting her diet as clean as we can, as good as we can, making sure her blood sugar is stable, improving her iron levels, and then taking a gentle approach to trying to get rid of some of these pathogens in the gut and support gut health, right? But really got to focus on inflammation and the autoimmune process. That's key for it'll probably be 6 weeks, maybe even 12 weeks. And then what we'll do is we'll move into probably 6 weeks, and then we'll move into a more aggressive antimicrobial approach to try to get rid of some of these bacteria and things in the gut and the candida. Put her on a lower sugar diet to help reduce like feeding it. And then we will work on kind of repairing some of the damage after we go through that protocol. So we'll give her things to make sure that we're healing the gut lining as good as we can, and make sure she's eating good foods that have good bacteria and prebiotics in it, so that we re-inoculate and we grow good bacteria in the gut. Okay, after we've tried to diminish and knock down the overgrowth of candida and some of these other bacteria. Then after that, what we'll probably do is focus on we'll be working on the oral infections. Then at that point, let's say that's about 4 months out. Then we'll start focusing on supporting detoxification pathways. And in the meantime, we're going to be trying to remove any potential sources of these chemicals from her environment. We're going to remove it from her personal care products. We're going to remove it everywhere that we can. So you see, it's a process, but that's how you have to I don't like people getting testing indiscriminately. You have to really have, what are you going to do with it? I have people bring me stuff. I have people bring me tests, and I'm like, why did you get this? This is not what you need. I understand. What I try to do is teach you guys how to help yourself, but there are good ways to do it, and there are better ways to do it, right? So I'm not going to fault you for that, but at the same time, just gotta be careful with that. Okay, just so that's crazy. That's crazy. This is how Hashimoto's and autoimmunity destroys relationships right here. And this is how, as healthcare providers, our doctors, I really hope that they're, I do workups, but I'm not, I still try to, I don't know everything, right? I don't know everything at all. I feel the more you learn, the more you realize you don't know crap. You don't know. You know a lot, but you realize how much that there's a lot that we just don't understand. And so I never try to be so certain about something that I don't leave the possibility that I'm wrong, because I could be, And I think as providers, we have to be honest with the people that we're working with as we can, and just say, if you don't understand what's going on, or somebody doesn't feel well, then you're better off just saying, I don't know, but I believe you, and I'm sorry you feel this way, and I'll do everything I can to help you, but I don't see it based on this testing. Don't tell them they're okay, and then make their psychology and make them more depressed and feel like they're crazy, and that it's something that's just wrong with them, and that they just need to get over it. And then their self-esteem gets crushed, and then they become, they become diminished. And that's not acceptable. That's not acceptable, because you're not just affecting that person. It just makes me mad. You're affecting their kids. You're affecting their husband. You're affecting their family. These people think that the doctor's right about everything. It's nuts. It's nuts. So anyway, that's my rant. But I see this a lot. I see this kind of stuff a lot. This is what we find in most cases. If you dig, you're gonna find problems that you're gonna have much better direction on why you feel the way you feel. So with this lady, I mean, our main focus is dampening the autoimmune process. I'm telling you right now, like that's the heart of it. Like guys, autoimmunity is such an epidemic right now. It's just, and I'm telling you right now, in conventional medicine, it's basically ignored. It's ignored until it's so bad that they can treat it. And what I mean by so bad is you have to be to a point where you need anti-inflammatories, steroids, or immune suppressing drugs. And notice every one of those things I just mentioned suppress and shut down physiology of the body. None of them do anything to work with, support, or in any way address driving processes. And so those are important tools, and I thank God we have them. I've worked with plenty of people with rheumatoid arthritis and lupus and other types of autoimmune conditions, and I've done a lot of testing with those people, and some of them I've not been able to help. And it's really hard to understand exactly what's going on with some people and why you can't get them better. There's a ton of factors, man. I mean, what if there's something environmental that you're not observing or seeing? Or what if, I mean, it's hard to say. There's just so many factors. And so I'm glad that we have some of those things to try to help improve quality of life. And, I've worked with a lot of people that have rheumatoid arthritis and their joints are just destroyed and they can't walk. But when they take, their immune suppressants and some steroids, they can move. And, I don't know if that's the right or wrong thing long term, but you know what, if I was in that situation, I might do the same thing. If I can't, if I try like what I'm telling you about, like this type of approach, try this and you just try to do everything you can, but it's not always that simple. So anyway, I hope this makes a little bit of sense. I'll try to look at some of the comments here, man. There's been a bunch of comments. Sorry I couldn't respond to them, but I wanted to tell the story. It's always the way it goes. It's gonna be 5 minutes and it's 2 hours. I gotta get to bed in a second too. Y'all should too. Of course, I'm on the East Coast, so it's like 10, 11. So I gotta get to bed soon. Telling you, that's one of the best things you can do for yourself, guys, is to get your lifestyle, your sleep cycles right. It's one of the best things you can do for yourself, I promise you. I mowed the grass today. If any of y'all follow me, you know that it's been like 3 weeks, like 3 days to the day. And I had a horrible respiratory infection after mowing the grass 3 weeks ago. That's how long it's been since I mowed grass. My wife told me today, she said, our grass looks horrible. She said, you got to do something. Like, okay, but here's my rationale. I'm letting the sprouting grass, because we sowed grass seeds. Dude, I'm going to be honest with you. My wife sowed the grass seeds. She's so awesome. She was like, we've got these bare spots in our yard. And I was like, yeah, I'm going to, let's sow the grass. I just come home one day and she's like knocked it out, spread like she even got some straw and spread it around, and just pretty awesome. I'm very fortunate. And anyway, I was like, no, the grass roots. We want to let the grass roots grow down. So let's let it grow tall enough that the grass roots will grow down and it won't die this summer. That's been my story. But I cut it today, and wish me luck. I wore a mask. Anyway, yeah, guys. I mean, so listen, if you have, I'm going to answer some of your questions. Okay, I'll answer some of your questions. Listen, if you guys have any like problems, like if you need help with this stuff, I mean, definitely do research. Like we have tons of videos and stuff that you can look at. But if you need help, I do work with people across the U.S. I mean, I just work with them as a client, a distance consultant client, and we still do super in-depth histories with people, and we can help you to order testing no matter where you are. If you need to do that, it's something that might be an option for you. You might get some benefit from like our guidebooks and stuff that we've created. Those are good resources. They're like our 9 lab test guidebook is like $7, and I just updated it. It's a fantastic resource to understand this stuff like I'm talking about much, much better, and especially understand your thyroid and what's happening there. But those are just, we've got to be our own advocates. Like you don't have to be, the one thing I don't want is I don't want you guys to be adversarial with your doctors or your providers. Granted, some of them have bad bedside manners. I'm telling you guys, they're highly stressed though. Okay. I know, and I'm not making any excuses for, you know, just bad work or bad attitudes. I'm not, but I mean, guys, it's one of the highest rates of suicide. You got to understand, like healthcare providers, you bear the burden of a lot of people a lot of times, and it can be tough. It can be tough because, um, people you see people at really low points. They're trying to get help, and sometimes if you can't help them, it's really hurts too. So anyway, let me answer some of your questions. Okay. Okay. So let's see. Uh, okay, guys, I'll answer some questions. You can go. Let me see. So I'm going to put in the comments here. All right, so I'm going to put our website, right? So you can just go and check out, like, you just go to, I just put in drbradshuk.com. Hopefully it pops up, but you can go there, drbradshuk.com, and you can learn, like, application for care. Just check out, like, what it's like for us to work together, and you can learn a little bit more about that. 9, if you're interested in, like, the guidebook, I think this is the website. I think it's 9 thyroid tests. I think that's it. And you can go there and you can learn about that. Those would be great places to start, things to think about, or ask me questions, or go to our video library and type in the search results what you're interested in learning about. If you're interested in autoimmunity, there's a ton. If you're interested in adrenals and cortisol, there's a ton. If you're interested in polycystic ovarian syndrome, female issues, adrenal issues, there's a ton. And I have videos where I draw out physiology and I teach you guys just like this. Okay. There's a ton of stuff. If you're interested in weight issues, body weight issues, if you're interested in fatigue, if you're interested in anemia, if you're interested in learning more about chemicals, I have a ton of videos where I talk about the science and physiology. If you're interested in leaky gut, I just can't tell you. There are a few hundred videos, and many of them are many of them are like 30, 40 minutes long because I genuinely try to teach you guys. You got to teach you how to help yourself. Okay. So, anyway, let's see. All right, let me try to answer some questions. All right, I'm going to bed in 13 minutes. I promise I'm going to go to bed 10:30. All right, 10:30 is the time. Can't find your book. Can't find your book on 9 thyroid tests. All right, let's see. Is that it? 9thyroidtest.com. Is that it? Okay, so it went there on my screen, but that doesn't matter here. Just here. Let me paste this one. There you go. There's another one I pasted in there, guys. Yeah, like, guys, definitely just look around. I mean, seriously, I'll do my best to help you out. That's why we've created, like, so let me just, before I answer the questions, here's our mission of our office. Okay, it is to empower people to help one person at a time. Because if we can help you, then that's going to make a positive change on your family. And if we can change that, then we can have an impact on your community. And if we can do that, we can change the world. One person at a time. And I want you guys to be better partners with your healthcare providers. Please do not be adversarial with your doctors because it doesn't get anyone anywhere. Like, it doesn't. You just don't fight that fight. Don't use your energy on that. Don't give your energy away to fight with someone like fight with a doctor. Just find someone new. Find someone new. Try, look around, look at reviews and find someone new if that's the case. Don't fight with someone. I always listen when I work with people. I encourage co-management. You need to have a primary care doctor and some people that you're working with, and then I try to complement what is being done. That's what we have to do because we need the best of all worlds here. So anyway, but I want you guys to be your own advocates, and I want you to be better partners with your healthcare providers, and I want you to be empowered because you can be. This stuff is, it's complicated, but you can learn enough. Listen, if you just like watch my whiteboard video, the one that's made its rounds around the internet, the most popular one that I've ever done, that video, if you watch that video, I promise you will understand more about thyroid hormone physiology than most doctors do know today because they just don't remember. They learned a lot of it, but they don't learn how it breaks down that way I teach it or anything. You'll learn a lot. You'll learn a lot about how to help yourself too. All right, so let's do this. Let's see here. Okay, so I'm gonna try to answer some questions. I'm gonna go in reverse order. I'm gonna start with the most recent questions posted. Okay, so I go back to the very first ones. Those people might be gone. We've been on here like 50 minutes. Okay, all right. Okay, so Mindy says, hey, I have nodules, a goiter, and I take levothyroxine 150, and I was hoping it would help with my energy, but I also have fibromyalgia and RA. Okay, so Mindy, I'm very sorry that you're dealing with these problems. I really hope that you're able to. Hey, Darren, what's up, dude? I really hope, Mindy, I really hope that you're able to learn something from this. Okay, so let me tell you, first and foremost, the most important thing that's going on here is an autoimmune process. Okay, that's one of the most important things. So definitely with RA, there's going to be massive inflammation throughout your body. Okay, so one of the most important things, if you haven't seen this, Mindy, go to just trust me on this. Go to my office, the office of Dr. Brad Shook, our Facebook page. Okay, and just go to the office of Dr. Brad Shook. Click on videos. And one of the first videos you'll see is a gentleman sitting in a chair. His name's Andy. And Andy has rheumatoid arthritis. And he tells his story about how we worked with him to figure out driving factors behind it. He had food poisoning. And he had a chronic infection in his gut. And that was driving the immune response. And once that infection was gone, within a few months, he was seeing significant improvement. Now, he's not like brand new. You know, his joints and stuff are still damaged, but he can, like, he would get fatigued. He couldn't do any yard work. I mean, it was pretty dramatic. So first of all, there's an autoimmune process that has to be considered. Wow, a lot of comments. Let's see. So the inflammatory process in and of itself will blunt and decrease your body's sensitivity to the thyroid hormone. So though you're taking more hormone, you may have problems with the sensitivity of your body to the hormone in circulation. So we see this a lot. So bear with me here. When you have problems with your hormonal physiology, there are 4 different pieces of that. Okay, there's production. So do you have enough of the hormone in circulation? Okay, that's mainly what your doctors are going to look at. Can you convert the hormone? So thyroid hormone T4 to T3. Okay, that's a conversion that happens primarily in the liver and in the GI tract, but mostly in the liver. So can you convert it? If you can't convert it, then you're not going to have the quantities. But they don't usually check T3. They usually only check TSH. Okay, so production. Then there's transportation. Can you get it from, where it's made in the thyroid, or when you take it from absorption in the GI tract? Can you get it from there to where it needs to go throughout the body? That happens in the bloodstream. That can be disrupted. Do you have sensitivity, which is what I would suspect is one of the major issues here? If you have high inflammatory loads, like you will have typically with RA, I've seen C-reactive protein off the charts with RA. C-reactive protein is usually 0 to 3. I've seen it like, I think I had one, if I'm not mistaken, like at 150. It was really scary. It was really high. I mean, I was really worried for the lady. Anyway, those are some of the major things that I would say, like, if it's still persistent fatigue, that's going to be a big issue. It's really, you got to look at that inflammatory and autoimmune process first. And there's probably several things that you might be able to do, like definitely changing diet up are things that tend to help. Following like autoimmune paleo types of diets are typically reasonable things to consider doing. Okay. I'm sorry if that's not super helpful, but I'm trying as much as I can to give you something useful here. Stream just takes so much to move. So when you're really fatigued and you don't have good energy levels, like, okay, I have a full video on this. I'm telling you, I have and you go to the office of Dr. Brad Shook, click on videos, type in like fatigue. I have tremendous full whiteboard videos on this that will help you fill that in so much, will help give you such good direction on it, rather than me, I'm going to try to answer some things here, but if you'll do that, it'll help yourself a lot more than me trying to explain it in just a minute or two here. Okay, so thank you so much. You are welcome, Serena. Hi, Christina. Is fainting normal with Hashimoto's? Doctors say there's nothing wrong. I just shouldn't get up too quickly. I feel pre-syncope almost every day. So that sounds like it might be like orthostatic hypotension, where you stand up, the blood pressure drops in your head because you don't have enough pressure, intravascular pressure, to keep it in the brain. So the gravity just pushes it out and you faint. I mean, when you see that, I really focus on things like, are the adrenals functioning normally? That's one of the main things, right? It's like adrenal function. And if the adrenals aren't functioning normally, then what you have to do is you have to look for the reason, like, why aren't the adrenals able to, why aren't you getting that response when you go from a laying to a sitting or a standing position, where you get vasoconstriction and you keep the pressure higher? Like, why is that not happening? Is there something affecting the adrenals? That's a tough one. I don't know if they've given you any clues on that yet, but I'm sorry you're dealing with that. Is it normal with Hashimoto's? Is fainting normal? It's not super common in the people that I've worked with. I mean, there's definitely people have it, but it's not extremely common. With Hashimoto's, it's not like something like, oh, if someone has Hashimoto's, they're really likely to faint. It's not that common of a symptom that you see with it. Charlotte says, hey, do you share information and work with someone's endocrinologist to get the root issues if they are not close to you? So Charlotte, here's the deal with the endocrinologist. I've worked with thousands of people. Okay. I think I've had like 2 endocrinologists that were even remotely receptive to any of the information that I had. Okay. What you find out, I mean, and listen, I respect this. Let me just say that before I say it. What I find out is that with most doctors, when you say I'm working with someone that is trained in a functional precision medicine approach to the thyroid and autoimmunity, it's diet, lifestyle, and nutrition. The most of the time they're going to be very skeptical, and they're going to caution you. Okay. And I respect the fact that they're trying to help protect you. Okay. But most of the time they're not open to anything. They're not open, because here's the deal. They can't run the tests that you need. They literally, if I'm telling you, they can't run the test because there's no, according to insurance guidelines, if you're paying out of pocket, I mean, then maybe they will, maybe. But there's a few problems here. The doctors cannot order the tests that you need, because under all insurance guidelines, unless you work for a really cool company that says, hey, get whatever you need, under all the insurance guidelines, they have a protocol. It's called a standard of care, and it's a treatment guideline. And these guidelines tend to be published by organizations like the Endocrine Society, all these different, and what they are, it's just basically like a flow chart. And it says, patient presents with fatigue. Here's what you can order. This is what we think is reasonable as a group, as a consensus. And you have to follow that flow chart, because in the contract that the doctor signs, the legal document saying, I will agree to see your patients, insurance company, and I agree to follow these treatment guidelines to see your patients. And if all the fine print says, if you fail to follow these treatment guidelines, we can sue you. You can face jail time. You can do all these things. So your doctors, if they're ordering tests for you that are outside of these guidelines here, if outside of those guidelines, I'm telling you, they're putting themselves at financial, they're putting themselves at all kinds of risk. I'm just telling you. I mean, if they order it for you, I mean, that's between you and the doctor. But I'm just telling you, like, that's one of the problems. So that's one factor. The other problem is like, why would they order testing that they don't know, that does not change their treatment approach? Okay, think about this for a second. Why would a doctor order a test that doesn't help them with their treatment? Like if they can't justify it and it doesn't have an impact on their treatment plan, why would they order it? That's like the definition of not medically necessary. Ordering something that does not affect or change your treatment plan. That's not necessary from a medical perspective, and the insurance company does not want to pay for that. And so since the tools that they have tend to be medication based, how does that help them at all? It doesn't help them. There's nothing that they can do. They can either give you hormone or take out a gland. You know, that's the short answer. So it's not cool. I know. I mean, I get it, but that's the reality of the situation right now that we're faced with. So I would, I love educating other doctors. I mean, I have doctors, medical doctors in my family. I've got good friends that are and that are. I have a lot of my clients are physicians, are very very smart people, but they're looking for a different option. And so um, anyway, I digress with that. But sorry if that wasn't the answer you wanted, but it's just the truth. Um, hey, Misty. Hi, Yvonne. Contact you, Yvonne. I don't know if you saw it. I posted the link to my website there. Hi, Maria. Hey, so there's a question with Raynaud's. All right. So Michelle says, I was once diagnosed with Raynaud's. Me too. Me too. So Raynaud's or Raynaud's, however you want to say it, is a problem where usually when you get exposed to, like for me, cold, if I get exposed to the cold, sometimes my fingers will go white, like this much of it will be just white, and it will stop like right at a knuckle, and it'll be solid white, and then it'll be pink the rest of the way. And what it is it's an autonomic nervous, it's dysautonomia. So your autonomic nervous system controls vasoconstriction and vasodilation of the vessels. So dilation and constriction of the blood vessels. So it is associated with autoimmunity. And so it usually, if you have Raynaud's, you end up, you're more likely to have an autoimmune condition too. I know that mine does that, like in the winter. It does it a lot. If especially, it's interesting. Like I've noticed the connection. If I don't drink any, if I'm not taking any stimulants, like no coffee, it doesn't seem to happen nearly as easy. If I'm well rested, it doesn't happen nearly as easy. If I drink a lot of coffee and I'm really fatigued, it happens really easily. So that's a very interesting sign there. Allergic to grass, Suzette. I guess I am. I mean, I don't usually have problems with mowing. I guess that's what you're referring to, or maybe you're talking about yourself, allergic to grass. But yeah, I don't usually have problems mowing. It was windy 3 weeks ago. It was windy. I was on the mower. It blew the grass right up in my face, like up in my nose, and I sneezed like 20 times. And I was like, "This is not good." I knew immediately, and then I just kept mowing. I guess you get what you get when you do stupid things like that, right? Hey, Michelle. Sleep cycle, Philip. Sleep cycle, absolutely. Sleep cycle is important. I was talking about that earlier. Raynaud's related to Hashimoto's at all? Absolutely. Raynaud's is related to autoimmunity. Misty, it is my bedtime. I'm 3 minutes past, guys. It's 10:33 here. I'm getting ready to go to bed. Guys, come see me, Suzette, if you need to. I'm on all of those. Yvonne, lost my thyroid because I listened to my docs. It was all in my head, they said. I'm sorry, Natalie. Janine, it's not, listen, I don't want to, listen, guys, here's the deal. I don't want to paint a gloom and doom picture here, and I hope I don't do that. Unfortunately, I talk a lot about problems, but I think you have to understand the potential drivers of these issues if you're going to be empowered to do something about it, right? If you're going to be able to do anything about it, you have to kind of understand what drives it. So we got to talk about problems a bit, but there's a lot of hope. I mean, I believe, the body is always working to self-preserve, to heal, right? If you cut your hand, and you just, it does it on its own. It heals. It's always working towards a state of balance and of health. So I think if we can just figure out the best way possible to get these things out of our environment that are triggering the immune response, give the body what it needs to properly function and carry out our chemistry. We respect ourselves by getting adequate sleep, and taking care of our bodies, then then I think we can start to really make significant progress. And sometimes it's as easy as someone changing their diet, guys. It's like that easy, and they do like amazingly well. But it's usually a combination of things that have to be addressed. Thank you, Laura. That is a super nice compliment. Thank you. Yvonne, yeah. Ryan, you need to bring me something. You do. Hey, Carissa. Carissa said she had a scoliotic correction. So she had a curvature of the spine 2.5 years ago at age 36. And her vitamin D was at 17, almost a year post-op. She has no energy, retaining fluid, tachycardia, hypertension, B12 is low, TSH has been normal, never thyroid issues that are normal for her, but only tested TSH. She has bloating, she's so fatigued, and knowledge retention is not the same. She was in grad school with a 3.75 GPA, a runner going into surgery, now GPA 3.2, can't lose weight or get back to normal weight. Carissa, so with bloating, I mean, I would just focus on optimizing, nutrient status. My computer is getting ready to die, guys. I'm sorry. This is appropriate though. I'm gonna have to stop after this one. Carissa's question. I'll try to answer the comments like later. Okay, like I'll look back over these. I promise I'll try to answer these comments and see. There's a lot here, and I know a lot of you guys, you need help. I'm doing my best for you here. So Carissa, with the energy, like you really need like a good blood panel. You need a good panel that looks at some very foundational physiology. Like, do you have high inflammatory markers? Number one. Number two, what's your blood sugar like? You need like a fasting glucose and a hemoglobin A1C are all reasonable things to do that I would do in similar situations. Looking at your red blood cells to make sure there's no shift towards an anemic state. Like you got to look at the size, the color, and the quantity of those cells. Look at the immune system to make sure there's no active immune response that's ongoing. I would look at ferritin very closely, which is your stored form of iron. Look at those iron markers and make sure that that's okay. The foundational physiology is where you find a lot of problems. I'm telling you, that's where you find a lot of problems. That's why that's always what I recommend first. Always foundational physiology first. Then I would look at your thyroid in more detail. I'd look at the 9 different thyroid markers. I would look at TSH, total T4, total T3, free T4, free T3, reverse T3, T3 uptake, and index thyroid antibodies. I would look for TPO and thyroid globulin 2. And so I would look at those things first. And then, there's probably retaining fluid. I would get some kidney markers, creatinine, infiltration rate, do a urinalysis. And then beyond that, there's probably some things that I would recommend, like looking at your adrenals and your hormones, just to see kind of what's going on there. And then obviously, we know a lot about your lifestyle, like what's your sleep patterns like, what's your stress like. And then I would, because of the bloating and some of these issues you're having, I would definitely get a stool panel. So I do all those things. Like that would be like my good recommendation. And you could go a lot deeper than that, but that'd be it. Okay, so guys, I got to go because I don't want to completely throw off my sleep rhythm here. Super important that you get enough sleep. Guys, I appreciate y'all so much. Hope you have a wonderful, wonderful day. Thanks for hanging out with me and listening to me rant. I appreciate all the wonderful comments and questions that you have. Please do post your questions and comments, and I will do my best to respond to you. If you need help, if there's anything we can do for you, please don't hesitate to reach out to my office. You can just go to drbradshuk.com. It's Dr. Brad, B-R-A-D, Shook, SHOOK.com. You can go check us out there. You can find us if you're on Facebook, you can just go to Facebook and you can try to message us there too. We get a ton of messages. So please realize that we don't have like a full-fledged team to help answer all those questions that come in. So you may have to call us or reach out to us more directly. But I do appreciate you, and I hope this has been helpful. I hope this Main thing I want you to understand, guys, is you can make a difference in your health. You can absolutely, you can educate yourself by, like, joining me, watching the videos that I've created, and you can start to learn more about these problems that you're having. And you can be your own advocate. You don't have to be, and you don't have to fight and be an adversary with your healthcare providers. Just realize that they're there to help you too, but they may have some limiting beliefs that prevent you from getting help from them. And realize that they're tied to insurance. They don't understand how to interpret or why they would even order some of the testing that, like, I would recommend for you. So just realize that there are some barriers, but you can do it, and things are changing, and together we can make a difference there. Okay. So I do appreciate you all. I'm so sorry. I know there's a ton of comments and I was not able to answer them, but I really do appreciate it. I hope you guys have a wonderful, wonderful day. Talk to you tomorrow.